Hello everyone, welcome to the presentation of this short paper with the long title Clientside Pseudonymization with Trusted Third Party Using Modern Web Technology. Let's dive right in. When doing research using medical records, these records come from a patient, and that patient's data needs to be protected. Usually, one dataset consists of two parts. The first part we call EDOT, which stands for identifying data. It consists of names, birthdays, social security numbers, and similar things. The second part we call MDOT, which stands for medical data. It can be things like heartbeat, blood type, or anything related to the patient's health. Those two parts are used for linking the data and for the correct treatment of the patient. To achieve data protection, the data needs to be pseudonymized or anonymized. In our application, we work with retrospective data, which means that the data has already been collected and is present in a database or a file, like a CSV or an Excel. So for example, we have Alice. She's a doctor and has all the patient's records. And Bob, a scientist who wants to get those patient records for research. Between them, there is a trusted third party, short TTP. Step 1. Alice and Bob agree on a password, but don't tell it to the TTP. Step 2. Alice opens up the TTP website. After logging in and putting in the password, she can upload the data. Using the password, the EDOT is hashed and the MDOT is encrypted. After that, it can be uploaded to the TTP server. Step 3. On the server, each record comes in and the hashed EDOT are being compared with the hashed EDOT which are already on the server. If the entries match, then that patient gets the same pseudonym as the record in the database. If they don't match, this record gets a new pseudonym. Step 4. Bob can see the new data from Alice and can access it through the same website. Once the data is on his machine, the data is decrypted using the password which he agreed on with Alice. The data does not contain any EDOT, just the pseudonym and MDOT. As you can see, the data is safe every step of the way. No personal patient information leaves the clinic, and the TTP cannot guess the EDOT or decrypt the MDOT. Now, this approach has been done before in a similar fashion. The new thing about our approach is that it is performed completely inside the web browser. No on-site installation is required. Software and data are hosted by the TTP, and not knowing the password, the TTP cannot decrypt the stored data. This makes pseudonymization much faster. No on-site installation is required, which means less administrative effort, and no patient data leaves the premise, which also means less administrative effort. Thank you for your attention. If you have any questions, leave them down below and I'll be answering them.